Now to a cost-saving, convenient way for patients to get certain hand surgeries.
For this week's Your Life, Your Health, medical specialist Emma Benson explains how one local man was able to resume everyday tasks thanks to a simple in-office procedure.
80-year-old Don Atkinson enjoys being active.
I used to ride motorcycles. We do a lot of camping, ATVing.
But pain in his left hand made it difficult to do even daily activities.
I couldn't button my shirt. I couldn't put my watch on because it was just excruciating.
He put off treatment.
I've been afraid to have anything done to it because who wants to go into surgery, right?
That was until he met with Dr. Chayton Irwin at Intermountain's Tosh campus and learned about trigger finger release surgery.
They're completely awake. Most procedures take, I'd say, between 5 and maybe 15 minutes. I'll let it sort of dry.
These types of procedures involve giving the patient a local anesthetic and making a small incision in their hand.
I presumed that we would go into a big surgical room, right? Like other surgeries. And when they said, no, we're just going to do it here in the office, I thought, whoa, I can do that. It's not that big a deal.
We clean and prep and drape with sterile draping and sterile instruments just like we do in the operating room.
Plus, fewer complications and quicker recovery times.
Do that again. It's really gratifying to be able to offer this safely to people that we used to think, understandably, were too old for surgery or too sick.
I could do everything with this.
Don had surgery just a few weeks ago and drove himself home right after.
I just can't even believe it.
He's once again able to do normal tasks.
There you go.
Like tying his shoes.
No way I could do this before.
But if you had to, would you do it again?
Oh, absolutely. The only thing I would do differently is the minute I think I've got to have it done, I'd be in there. Because I waited way too long. I suffered way longer than I needed to.
For Your Life, Your Health, Emma Benson, KSL 5 News.